guys, how are we doing today? Good morning. So here we have Dr. Gurani. We're gonna be doing a Q&A, okay?
Hi, good morning. Thank you. I'm very happy to be with you.
Great. So we're gonna start with some questions about his new procedure, right? Aveli. So
Okay.
you want to tell us a little bit, what does Aveli do?
Okay, so Aveli is an FDA-approved instrument that is very helpful in the correction of cellulite and dimples. So it's a very ingenious design. Does not cause a lot of trauma when it goes in. We basically basically a stick that deploys a device that allows us to very specifically and very targeted a removal of these dimples. So the dimples and the cellulite that can be corrected with this is a type of skin deformity that's caused by fibers that are attaching to the skin down to the muscle. And those are the type of dimples that a patient can tell if they're the type of dimples that can be fixed by pulling on the skin. And if that dimple stays there, that means those fibers are really short and tight and are causing the skin to be drawn in. So what you do is basically make a small puncture wound and get in there, and when you as you're going there, you're not traumatizing the tissue a lot. It's very minimal. And then when you get to the point, that instrument can be opened up and you can pull on these fibers and you know you're in the right place, and you can then cut them with a small little blade that's there. The rest of the movement is the blade is protected and it's not cutting unnecessary tissue. So I like the technique. It's very targeted, and it doesn't solve the where you have loose skin or excess skin and you get the little rippling like wrinkled paper. What it does, it helps with those really definite dimples that are where the skin is pulled in. Okay, so that's the indication for it.
Okay, and for somebody, for example, that is looking forward to get Aveli, right? Do they have to be like a right candidate for this, or is there any time it could be like a wrong candidate for that?
Yes, I don't know if you a few seconds ago or a few minutes ago I was telling you about how if the dimple disappears when you pull on the skin and you tighten the skin, that probably is not something that's going to be fixed with the Aveli. But if you have these definite dimples that look like a geographic shape and where the skin is pulled down, and then you try to flatten the skin or stretch the skin and that dimple is still there, then you know those fibers are short and they're pulling down on that, and if those fibers are cut, then that tight fiber will release and will allow the skin to expand. So those are the type of dimples that really help. And obviously the patient, I don't expect the patient to know this by themselves. That's why an exam is helpful. You can send us pictures with the patient's skin relaxed, and then they can pull above the area, and if that disappears, then you can tell. If that dimple persists, stays there, then there's a good chance that can help it. Now like I was saying, it doesn't eliminate the excess skin where it's just rippling because of loose skin and laxity, but it's those tissue. It's the tissue that's pulling down on the skin and it's causing a divot. That it can definitely fix, and that makes a great improvement when nobody has perfectly smooth skin. It doesn't exist. Only babies, maybe. Okay?
Of course.
But as we get older, the skin gets looser, and there are certain fibers that are shorter than others, and they cause those deformities. And definitely, we can cut those.
Okay.
And it can be added to other procedures. Definitely can be added to a liposuction. It can be added to a tummy tuck. It can be added to a breast case. So there's no limitations on where it can be added. And sometimes, if you're doing the BBL, we can also add fat to it.
Oh, that's great. That's great to know. So I have a question here. Somebody said the best doctor ever with a red heart.
Thank you so much.
And we have a question here that says, what happens when you smoke before a scar correction from a tummy tuck?
Okay, smoking has a lot of poisonous chemicals that are in the smoke that you inhale, that gets through your lung into your circulation and increases these toxins and these chemicals, decrease your blood flow, decreases the oxygen to the area, tightens your vessels, so your healing potential is lower. You can have skin loss or increased chance of infection and the scar not healing. So I really recommend for all surgical procedures to stay away from smokers, which is secondhand smoke, and not to smoke for at least 3 to 4 weeks before surgery, so you can clear that tobacco. Tobacco comes in so many different forms, whether it's vaping, smokeless tobacco, chewing tobacco, regular cigarettes, so on and so forth. So there's so many forms. You should stay away from it. And remember, again, I mentioned at the beginning, secondhand smoke. So you can have friends and family that smoke, so you need to stay away from it.
Of course,
Okay.
very important. So I actually have a question that I wanted to ask you.
Okay.
So when you are doing a breast augmentation,
Okay.
right, where do you place the implant and why?
Okay. So my preferred method, that's been my preferred technique for now at least 12 to 15 years, is I like to go above the muscle, under the breast. I feel that is a more natural augmentation. You're augmenting the actual breast tissue, and I feel that the implant, it does not fall to the side as much, because when you have it under the muscle, and again, the word under the muscle is not really an accurate description. It is partially under the muscle, and I feel like with my experience of going in on multiple patients that are here for implant exchanges and or going bigger or whatever, I notice that the muscle window shades up, and it's very seldom to see that the implant stays under the muscle. That concept was used to reduce the capsule contracture rate, and I think that with the new implants and the smoother surface, the implant under the breast tissue does not have as much chance of getting capsular contracture as much as it used to be, and it's also technique dependent. But I think that we get better cleavage because it's under the breast tissue and the muscle is not pushing it to the side, and by not having the muscle push it to the side, you get less of a side boob, which a lot of patients complain about, that the gravity is working against you, it's pulling the implant down, and the muscle is pushing it to the side. So my preferred technique is to go through the fold. That's the easiest place to hide, and I think it is cleaner. You can really clean the skin very well before you go in. I don't like using the nipple areola. I don't like using the armpit because I think that they're can contaminate the implant, and I think it's can cause increased rate of sensitivity. So my goal is to, if I'm doing a primary augmentation, is to go through the inframammary fold and put it above the muscle under the breast tissue. I don't like going through the breast tissue.
Amazing,
Okay.
that's great. So we have a question here that says, I had a BBL with Dr. Gurani, had a C-section 2 years ago. Could I get a BBL again, or would it have to be a tummy tuck?
It only has to be a tummy tuck if you have loose skin. Okay, if you've gained some weight and you're not happy with the fat deposits around your waist, your love handle, your bra line, and to your abdomen, so send me an email or a text message with your pictures, and I will look to see if you have appropriate fat deposits, and then we can definitely do a liposuction if that's all you need, or plus a fat transfer. The tummy tuck, you guys have to understand, is strictly for removing extra skin, loose skin that's not going to come back after your pregnancy.
Of course. So we have a comment here that says, I love you, Dr. Gurani. You changed my life. You really are the greatest, safest doctor.
Thank you. I pride myself on the support of my patients. I notice that every time we go on a live, I get these very positive comments and a lot of love from my community. I appreciate that, thankful for that, and safety is number one.
Yes,
that's
of
how
course,
it works.
Of course. So we have a question here that says, does he do fat transfer to the breast?
Okay, so fat transfer to the breast is been around for a while. I started doing it early in my career, and I have good experience with it. I used to do it for cancer patients. After they received a mastectomy, the breast cancer patients the general surgeons would remove the breast, and they would leave them with very little fat. So when we did the reconstruction with the expanders and then placed permanent implants, they would have that stuck on look. So I got comfortable hiding that upper part of the breast with fat transfer. So I use it mainly in my practice, not as a full augmentation, because I still think that the implant augmentation is more superior, and I personally think that to get the same result with a fat transfer, you have to do it over multiple procedures. So I think implants are the best in terms of enhancing the breast, unless you're really against having a prosthetic. So going back to the question of fat transfer, I use it to hide the borders of my implant if a patient is very skinny. I've used it in the face, I've used it to enhance other parts of the body as well. But yes, I do selective fat transfer to the breast, but I really don't think it's as powerful as an implant when it comes to doing a whole breast augmentation.
Of course. So we have a question here that says, if I have a breast implant capsule, can I remove those implants and put new implants?
So if you have every patient has a capsule. If your capsule is thick and tight and causes a deformity, then what I can do is go in there through the same incision, hopefully your incision is below the breast, and remove the whole capsule with the implant. So it's like an envelope that surrounds the implant, and when it gets thick and hard, it's uncomfortable, deforms the breast, and so what needs to be done is the whole capsule has to be dissected out, and we start fresh with a new pocket, and definitely new implants.
Of course. So we have a comment here that says, definitely looking into Dr. Gurani for my round 2, but I'm not sure I have enough fat.
The only way that I can help you with that is to send me your photos, a picture of the front, the back, and the sides. Raise your arms so that I can see under your arm. We seldom have a problem finding fat. We have fat in the anterior abdomen, between the thighs, in the underarm, in the arms. So I've done a lot of round 2s, and there has been maybe 1 or 2 patients in the majority of my career that I had to turn away because they're just too skinny.
So we have a question here that says, can a scar repair open up if you smoke 4 days before surgery?
Yes.
Okay.
Yeah, you should really, I can't emphasize this enough, stay away from smoking and secondhand smoke for at least a month.
We have another question that says, does he do extreme liposuction?
I don't know what that means, but I do very good lipo, where I take away the excess fat from areas that are distracting, like the underarms, the bra line, the flanks, the waist, the anterior abdomen, and give you that nice hourglass, enhance your own natural anatomy that's being hidden by the fat deposits, and give you that hourglass. So I don't like the word extreme, I don't like the word aggressive, I like appropriate. You know, I have an eye for symmetry, I understand the anatomy of the human body, whether male or female, and I try to enhance it and show what you have under your skin and what's hidden. So I guess I don't like aggressive, I don't like that word, because it can give a negative and irresponsible type of approach, and I like to do things the right way and safely, but effective.
Of course, yes sir. So we have a question here that says, is arm lipo or thigh lipo worth the add-on?
Yes. If you need the fat, yes. If the arm and the inner thighs are a little bit out of proportion to the rest of your body, I think it's a good idea because we gain weight everywhere, right? Arms, inner thighs, abdomen. So if those areas that you mentioned, the arms and the inner thighs, are a little bit over contoured, if they are if one gains weight there, I'm trying to find the right word for it, if you're not happy with the shape, let's address it. Let's bring it into harmony with the rest of your body.
Of course. So we have a comment here that says, Dr. Gurani, I will be coming back. This is me again, the one with 13 siblings. I told you about that, the Prestige. My body's still bodying, and I'm coming back for round 2. You're the GOAT.
Thank you. amazing, amazing. Never ceases to amaze me, the support. I'm doing something right. I think patients realize this, that yeah, I'm sincere, I care about my patients, and I do things according to the standard of care, basing my decisions on science, but not forgetting that we are dealing with a human being, and everybody's different, everybody's an individual. So, you know what? Knock on wood. I'm very proud of my work. Thank you.
You're
Thank
great,
you.
of course. So we have a question here that says, can you do breast augmentation with lipo?
Yeah. I mean, you want to be careful that you don't go crazy, because you know. But yeah, you can do lipo, and now again, everybody's different. So please allow me to see your picture, and I'll give you the best advice possible. But we can combine lipo with a breast augmentation.
So when you are doing a BBL and the Lipo 360, right? Let's say somebody that might be a little bigger, would you recommend for that person to add on upper back lipo?
See, the Lipo 360 or the 12 areas, all those terms are being thrown around, but what people don't understand is that the anterior abdomen goes from the below the breast to the private area. So you've got to draw a line around, and that's where the Lipo 360 is. It goes from the bra line down to the waist. So if you don't address the upper back on patients that have gained weight, or the underarms, those areas will look out of proportion. You look wide up top. So you might look like an hourglass, but then you're just too wide over there, and that bothers some people, and patients have asked me for it. So yes, I think it's worth it. And you know, like I said, we gain weight all over the body from head to toe. So yeah, I think it's a good idea, and I'll be the first one to suggest it if I think it's appropriate, or to tell you no, don't do it. You know, just like the inner thighs, we spoke about it a few minutes ago, the arms. If you're genetically predisposed to gain weight in your arms, you might actually thin down in the lipo or in the gym, but the arms will be out of proportion. So you want to, again, it's going back to harmony, smooth transitions, no interruptions. You don't want to be thin and look in shape, and then the upper body looks out of proportion.
Yeah, of course. So I have a question here. What is the Mommy Makeover Plus?
Okay, so the Mommy Makeover Plus is, we're addressing the breast, whatever it needs, either an augmentation, a breast reduction, or a breast lift with implant or without implant, a tummy tuck, and then a patient can add a vaginoplasty, which is addressing the GYN area, or the labia majora, labia minora reduction, or reshaping if they're bothered by the skin around the vagina. So that's what it is.
Oh, great. So we have a question here that says, I know you want us to stay in Miami for at least 7 days after Lipo 360.
Correct.
But how many days do you recommend we get a private nurse for?
That's a little bit individual. It depends on how you recover. But if you at least book them for 48 hours, it will be a smart idea. The first 24 to 36 hours are the hardest, and after 48 hours you're pretty much cruising. So if you have a family member with you, we recommend that you stay in one of the hotels around the clinic, so you don't even need to rent a car. You can walk here, and the private duty nurse can pick you up from the clinic, take you to the hotel in their car, and then bring you while she's watching you. And I think that really, honestly, it makes me feel more comfortable, because I feel the patient is safer than going to a recovery house. I think the private duty nurses, I mean, we are not affiliated with anybody, but there's a few good ones out there that I have used, and my experience has been very positive because of the patient feedback. So I think it's very smart to stay around the clinic, because we're so close to the airport. We have everything that we need for a patient. Literally, you don't even need a car. You Uber here for clinic, get pre-op, have surgery next day, and recover in one of these hotels that have room for family. You can cook and do all that stuff, and then the private duty nurse is just there watching you one-on-one. I think that's invaluable. You can't, there's no value you can put on that.
Yeah, super convenient. So we have a question here that says, how much can you take out of the stomach area during a mommy makeover?
You're talking about removing fat or removing skin?
I think they mean maybe excess skin.
Yeah, so I usually try to remove as much as I can without damaging the blood supply or making the scar so tight that it ends up having decreased blood supply and opening up. So usually I end up somewhere above the belly button, you know, and that also just depends on how much laxity the patient has, you know, how loose the skin is. And yeah, that's pretty much it. And in terms of the lipo, along with a mommy makeover, I try to be careful because even though we offer it, doing some lipo with a mommy makeover, I don't do a fat transfer to the buttocks with a mommy makeover, mind you. The lipo has to be carefully done because you don't want to damage the blood supply to the skin. Because when you're doing a tummy tuck, you're making a big incision down here, you're raising the skin away from the muscle, and you are depending on the collaterals, the blood supply from the side. So that's when the lipo has to be done carefully with good judgment, and it's not done at the same level as you would when you're doing a lipo 360 when everything's still attached.
Of course. Of course. Do you mind explaining why you don't do mommy makeovers with BBLs?
Yes. So a mommy makeover is still in itself a big procedure. So you're doing a breast procedure with a tummy tuck. That's a massive surface area that's being addressed, and it has increased risk over the smaller procedures. Okay, and you have a patient that's sitting there on the table anywhere from 4 to, you know, on average 4 hours, and then you add to it the trauma of the lipo. I think that is excessive, and I don't think it's smart to put a patient that has just had a tummy tuck on their abdomen to do a BBL, or vice versa, do the lipo, re-inject the fat into their buttocks and make them lay on their abdomen to start the mommy makeover. I think it's just too much surface area that's being addressed, too much stress on the body, and both the BBLs and lipo and mommy makeovers are increase your risk because they're bigger surface area, a lot of surgery, a lot of suturing. So then you're combining the two. I think is too taxing on the body. It's just too much on the human physiology. I know a lot of people do it and are getting away with it, and I think that based on my record and my reputation, you guys know that I like to do things using the fundamentals of science and medicine and evidence-based medicine and patient safety, and I think it's just asking too much of the human body to tolerate all that. Patients are under anesthesia for too long, and I don't think it's the anesthesia itself, it's just the trauma to the body. And just because people are lucky enough to get through it, why should we not do things predictably? Why shouldn't we do the safe thing that we know the parameters and what the outcome is going to be? Okay, so taking a risk is not something I like to do. Okay, I always like to know that I'm going into something that is going to have the best outcome possible. Okay, so and the last thing I would say about it, and I know I'm sure I'm going to get a lot of pushback from even other professionals in the community of plastic surgery. I think that the outcomes are less than desirable. I meet a lot of patients that come back from different parts of the world or from the United States that are complaining about one thing or the other. The breast doesn't look right, the tummy doesn't look right, my BBL is not good enough. So you're compromising you're increasing the risk of complications, and you're compromising your result. So like it just doesn't make sense to me.
It's also very complicated to sleep. I can just imagine, right?
I don't know how you recover. I don't know. I'm glad you mentioned that. I forgot to mention that. How do you rest after that surgery? How do you recover? What do you favor? Your BBL to keep your buttocks nicely shaped, or do you lay face down? I mean, I don't know. I don't get it. And stretch your incision and damage your breast incision. I'm seriously in awe when people do say that to me, and maybe I'm the odd one out, but honestly I have enough experience and conviction in what I'm saying, and I don't have a problem saying it out loud.
Of course, that's great. So we have a question here. When can you stand up straight after a tummy tuck?
In my case, is right away. If you cannot stand straight, there's a problem. It's been done too tight, and that can mean that the incision might open up, or the incision might end up getting wider. I make sure that when you stand up, everything is nice and flat, and it's the right amount of skin removal that it doesn't compromise your posture. That doesn't make sense to me.
Yeah, of course. So we have a question here that says, what is the difference between a full tummy tuck and a mini tummy tuck?
Mini tummy tucks are, I think, the term is used very loosely. The ladies that qualify for a mini tummy tuck is somebody that is in excellent shape and doesn't really have a lot of loose skin, and it is an area that is very small, like pretty much the size of a C-section scar, like right above the Mons area, and they don't have excess skin outside that area. So usually people are extremely fit and had a few pregnancies and don't have that much loose skin outside the C-section scar. That's where mini tummy tuck comes in handy. Majority of us human beings out there that are not, in the greatest of shape or super athletes, you're gonna have to extend that scar at least to the hip bone, from hip to hip, and even past that to be able to remove the extra skin.
Okay, so we have a question here that says, can you get a tummy tuck if you plan to have children in the future?
Yes, I've had multiple patients. Preferably, at least from a logical standpoint, finish having kids and then address your aesthetic needs.
Yeah.
But yeah, no, I've had patients have BBLs and tummy tucks and then get married or decide to have a baby, and a lot of them hold up fine, and the ones that are need a revision after that, after the skin stretches out, they can always come back. But you know what, a lot of them hold up very well. Yeah.
What is the difference between a BBL and butt implants?
Okay, so BBL is removing fat from your torso and then transferring that, your own fat, under the skin of the buttocks into your native buttocks fat to enhance the shape of your buttocks and the size of your buttocks. Butt implants are either placed inside your gluteus muscle, or sometimes I've seen it placed above your muscle, below your buttocks fat, to enhance the size and shape of your buttocks. So it's like, think about it similar to breast implants. Okay, you use a silicone implant to enlarge your breast. Same thing with the buttocks. I don't like doing them because they have a very high complication rate, and they can drift, they can flip, and sometimes they can cause pain. So I'm not a very big fan, and that area is very hard to keep clean. So there's a high infection rate. Okay.
Okay. So when can you sit after a BBL?
Usually I want you guys to wait 4 weeks without sitting. So you're gonna do a lot of standing, or a booty pillow to raise your buttocks, or sit on your knees and face the opposite side.
When can you return to exercising after a BBL?
Okay, simple exercises, walking, light resistance work with rubber bands you can do right away, but heavy weightlifting in the gym, squatting, lunges, dips, all that stuff in 3 months.
What is the difference between saline and silicone implants?
Okay, so the saline and silicone, the silicone is silicone through and through. So there's a silicone envelope, and the filler inside the implant is the silicone gel. And now we're into our 5th generation gel, and they are really nice. It's very advanced, and the gel is not like syrup, it's not liquid, it has a nice consistency, and they feel very natural. Saline is a silicone bag that's sent to us sterile and empty, and we have to fill the bag after we insert it into the pocket with normal saline. And that's the main difference. One is filled with saline, one is not. Okay, and I think that the ones that are with silicone are more natural.
Yeah,
yeah.
They feels better.
Much better.
Yeah. Okay, so we have another question here that says, what is the hourglass lipo?
Hourglass lipo is basically every lipo I do. Okay.
Yes.
Hourglass lipo is cleaning up the underarms, the bra line, the love handles, the flanks, so that you look like an hourglass. Narrower in the middle and flare into the hips, and wider as you get to the top.
We have a question here that says, how long should you wear your faja?
Minimum 3 months. and that's not the same faja. You have to sometimes change sizes, go to the tailor and take in the faja that you're wearing initially because it gets too comfortable, and then you're wearing foams. Patients know that I don't like boards. I think that I don't like corsets very much. I think I like a good snug faja with foams and a lot of massages.
How long would you say that a BBL procedure takes in the
Anywhere from an hour, 45 minutes to 3.
Okay, great. So I have a question here that says, how does weight gain or loss affect tummy tuck results?
If, I think it doesn't affect it that much. If it's done properly, your body just gains weight or loses weight as it goes. Now, if it depends on the quality of the skin, but usually you look good either way.
What are compression socks and why is it so important?
Okay, compression socks, medical compression socks have different strength, and they help with the circulation. So it helps with the swelling of the lower extremities and helps with the venous return to the heart. It improves the circulation.
So somebody asked, are you double certified?
Yes. I have a double board certification.
Perfect. So how long is the recovery period for BBL to be able to return to like daily activities?
Usually you're walking from the first day, and I think work, depending on what you do, but usually 2 weeks we have you guys off and then go back to work. Now you have to be careful, depending on you can't sit down, you can't do heavy lifting, but we always help you with letters for your employers to regulate and adjust your activities at work.
Okay, great. We have another question that says, when should you start seeing a major change in your results for a BBL?
You see the major change right away. I mean, then every patient that stands in front of the mirror after you remove the garment, they're happy, and it's a life-changing procedure, because those annoying love handles, that fat that's in the front that's making a patient look wider or square or out of harmony, is gone right there. And as you move along with the recovery, in weeks and months down the line, your swelling goes away and continuously shrinks, and it looks your waist looks even better. It's amazing. It's a very powerful procedure. Lipo is amazing.
What are the best sleeping positions after a BBL?
Face down. There's no other sleeping position. Because if you're having fat transfer to the buttocks to give it projection and round it out into your hips to give you nice hips, parenthesis shape, you don't want to sleep on your buttocks and you don't want to sleep on your side.
Would you say it's good for a patient to invest into one of those chairs, that...
I don't like those chairs.
Yeah.
I think they mark the skin. They mark the skin, and I don't think it's a good idea.
Okay, great. So how can you maintain tummy tuck results long term?
If it's done right, it should be maintained. If it's done the right way, if it's not done under a lot of tension, I think patients will gain weight, lose weight, and I think the tummy tuck will stay fine. Now, if somebody gains a lot of weight or goes through a pregnancy, that can stretch the skin, and I understand if they would need another one. But usually, if the tummy tuck is done right with the right technique, it should last.
Would you recommend J-plasma to somebody that's getting a BBL or a mommy makeover, for example?
J-plasma is something that you have to do in conjunction with lipo. So yes, you can combine it with BBLs for sure. With a tummy tuck, you really have to be careful. You cannot do it in the front. You cannot really do it on the flanks either, because that's where the blood supply is coming from. And remember, the concept of J-plasma is heating up the tissue to help with remodeling and shrinkage. So if you're cutting the tissue and depending on the blood supply from the side, and you have the blood supply in the middle coming up through the muscle not there, then the redundancy in the system is removed, and then you're dealing with healing issues and maybe skin necrosis. So we have a lot of good technologies that we use, but one needs to use their judgment, and not just because we have it, we have to use it. You can't throw everything but the kitchen sink at someone. You have to use your brain to know what is the effect, what is the result of that procedure, whether it's ultrasonic using the
Saying, you guys, thank you so much for joining our live today. If we missed your question, you guys, you can put them in the chat, or you can DM Dr. Gurani personally. You can also schedule a free consultation, whether it be virtual or in person. Don't worry if you're out of the state or if you're out of the country, we got your back here. Dr. Gurani does virtual consultations too.
Definitely.
Yes, you guys. So thank you guys so much for joining. Thank you, doctor, so much for your time.
And thanks for the good questions, and thanks for the beautiful comments, and we'll see you in the next one.
Thank you guys so much. Bye.